Our idea is to increase tax on alcohol, cigarettes and fast foods. This should make people want to buy them less, saving money and helping them control their weight. It should decrease the demand for gastric bands, which are very expensive. In return, this will save the government money. We want to improve the services at A&E, so there's less waiting times for patients, especially those who are in a lot of pain. We need quicker and more efficient services. Facts and figures show that in the UK, the estimated 60.8% of adults and 31.1% of children are overweight. Between April 1st and December 31st, 2012, an extra 2,876 people have attended two A&E departments run by Western Sussex Hospitals NHS Trust, in comparison to the same time period in 2011. The amount of A&E patients is rising rapidly throughout the year in the UK. King's Fund think tank say that 226,000 people waited for more than 4 hours in A&E in a 90-day period. The amount of patients waiting for more than 4 hours is also increasing. There are generally good services at A&E, but waiting times need to be improved. In addition, we think that exercise needs to be encouraged more. If sports and leisure facilities are easily accessible and affordable regularly, it will keep kids and adults fit and healthy. It will also keep kids and teenagers off the streets and committing offences, which may reduce the spending on public protection sector. Berwick District is a place of sporting facilities. People don't go because 15% plus have lack of interest and 20% plus is too far away from home. The demand for gastric bands is increasing. NHS gastric bypass operations are up by 530% over the past 5 years and costing us £85 million a year. The fitter and healthier people are, the less overweight they will be. Therefore, the less gastric bands will be needed, which will save the health sector a lot of money. 18,577 gastric bypasses and 7,650 gastric band operations were carried out between April 2006 and March 2012. NHS spent up to £81 million on gastric bypasses and up to £10.5 million on gastric bands last year. The operation, which cost up to £15,000, was carried out 5,407 times last year compared to 858 procedures in 2006 and 2007. This is a massive increase. In conclusion, we want to increase taxes on alcohol, cigarettes and fast foods. This would reduce the amount of overweight people, which means less gastric band operations are needed. This will save money in the health sector, which then can be spent on improving A&E services and making sports facilities and clubs more affordable and accessible, also making them look fun and appealing. This will encourage younger people to take up a sport. This will also help to keep them off the streets, which will affect the public protection sector in a good way.